Good morning, everybody. Thank you for joining us for the York County Community Sector Briefing. We are trying to get this live on Facebook, but we will just go ahead and go forward here. Laura, are you available?
Yes, I am. Good morning.
Good morning. Where's your camera?
I had a little surgery and this week, and I'm not really don't want to
Enough said.
the screen.
Well, I'm glad you are joining us by voice. It's great to see you or hear you this morning. Be with you. And we will let you go ahead and get started.
All right. Good morning, everyone. I'm just going to give that public health report. It's good news is that our numbers just kind of still seem to be decreasing. We've been having about a case a day now. So just those numbers are looking better and better all the time. So just starting off to give a little background on Nebraska, we've had over 16,000 cases in Nebraska, 195 deaths. So in our Four Corners district, we have had a total of 130 cases, and 114 of those people are recovered. Speaking specifically about York County, we're at 37 cases, and we only have right now 2 people who are still sick. So that's pretty good. Our leading county is Butler County. They've had 51. Polk has 11, Seward has 31, and York has 37. So York's just kind of been sitting on that 37 number for a little while here, and so that's good news. We've been real busy at the health department approving events. So we've had a lot of people submitting with the new directed health measures. There is for anyone having an event in a venue that holds 500 people. We are able to approve those events as they follow the directed health measures and make sure they have a strong plan for having the events. So it looks like we're going to be having some events and opening things up here this summer, which is, I know, really good news for everybody. If anybody is planning an event, just please go ahead. And I know many of you on this call have been planning events and have submitted those to us. So we're happy to try to work with you and get those approved. And but that survey is also your plan. And if you have an event you want to get approved, you just go to our website and you can submit that on our website, and we'll work with you. So and we also are listing all of the events that have been approved on our website, so you can see the kinds of events that have been approved. And if you're wondering if your event, you might see something similar in there that you are someone you might even want to talk to if you're planning something and want to know how they're getting it done. Another thing we're working on right now, and this is kind of as a result of a request from the community and also especially from our schools, we're going to try to put together it's called a risk dial, and it's modeled after what they've been doing in Lincoln Lancaster County. And on their website, they have they basically are kind of, it reminds me of what has been done with Homeland Security and how they have put, different levels, red, orange, yellow, green. We're going to try to have something like that on our website as we get it developed, so that everyone kind of knows what stage we're in going into the summer and fall, so that it helps everyone in that decision making. So that's kind of exciting. One of the things that I wanted to make sure all of our healthcare providers know about, and if you want this information, I will be trying to get this out to you. We have one of the new requirements that of the long-term care facilities and assisted livings is to have some expanded testing of their employees and staff. And it's called the Long-Term Care Facility Baseline Testing Project. And there's going to be some conference calls next week about this. And I want to make sure that we, if you're in healthcare and you're interested in being on one of those conference calls, it's with the state health department. They're going to explain how they're going to accomplish this. And so those conference calls are going to be every day next week, late in the afternoon. I want to make sure you have that connection information. So we'll try to get that to you. Test Nebraska is in Seward tomorrow and going to be testing, and they're going to be coming back to York next week on Thursday, Friday. So we're going to be also increasing, working with some of our healthcare providers to increase our local ability to do testing. We have 3 hospitals and the state health departments involved in that, and the National Guard. So that's also happening. And I think that's all I have from my report. Of course, I'm happy to take any questions. But Jenna, would you like to give an update on the personal protective equipment?
Yes. I figured since you didn't have your video today, then I'll turn mine on. So we received a shipment on Monday from the National Guard, and we're going to be receiving another one next Monday also. And so we're just going to ship both of those out or deliver them out early next week. Since our requests are starting to slow down, I'm not sure if the state is going to slow down their shipments, as in shipping, every other week or once a month. That's not been determined yet, but they are saying that requests coming in are starting to slow down. And as far as the supplies they're sending, they are just sending, whatever they can. So brands of masks or gloves might be different with every shipment we get, and we're seeing that a lot. But it's just whatever they have available and what they can get in. But all the supplies are checked to be CDC approved before coming to us at the health department to deliver out. So I think that's all I have today.
Lisa, I have a
Yes.
question. I have a question for Laura.
Okay, thank you, Margaret.
Hello, good morning, Laura. You shouldn't even be on this call. You should be in taking your aspirin and have your foot up. Anyway, would you please remind us that even though our numbers are not scary numbers, we still need to be vigilant about masks and social distancing. I'm so afraid that we're going to get lax and then all of a sudden we start spiking up again. So would you just remind us that as leaders, we need to be sharing that information?
I'd be more than happy to, Margaret. That's a big part of what, as we do these event planning, plan these events, we're really encouraging wearing those face coverings. It's so important to help. That's one of our tools that we have. That together with the social distancing, and we're not out of the woods yet, so we want to make sure we're still protecting people. And this is one of the tools, some of the tools that we have as we plan on even, trying to get schools open and things in the fall. So yes, please, everyone, it's really important that we still wear those face coverings and masks and social distance, and use both of those tools together is really the most effective. So thanks everybody for, I think that the part of the reason that our numbers are as low as they are is that we're doing those things. And thanks everybody for your efforts. Good reminder, Margaret, thanks.
Thank you, Laura and Margaret. And Laura, just to make sure, there is a chat for you in the chat box, so if you can go look at that. And we will move on to the governmental sector. Randy, do you want to kick us off?
You bet. I don't have a lot to say this morning, which is surprising to Tammy, but so I'm just going to give you an update on our DMV situation that we're dealing with at the courthouse. Last week, Thursday and Friday, I kind of warned everybody if they could stay away, it's probably better for them. We checked in 502 people into the courthouse between the 2 days. A lot of our visitors are from Lancaster and Hall County. Currently, there's about 70 counties across the state of Nebraska of the 93 that are open. Unfortunately, most of those that are not open yet are still surrounding us, and Lancaster and Hall are not open to do DMV. It looks like they will be next week, but this week I'm going to give the same warning. Boy, if you got anything to do, just be patient because you're not going to get in. I haven't been over there yet this morning, but I assume the lineup is out there already this morning, and we'll probably deal with the same thing this week. Hopefully not next week. Hopefully we start to return to normal. But as far as everything else goes with the county, we're kind of operating as is. We'll have our meeting next Tuesday, and I think everything's slowly getting to where we want it to be. If I can answer any questions other than that, that's all I got today.
Thank you very much, Brandy. We really appreciate it. Barry, are you on?
I am. Good morning.
Good morning.
Not a lot, just a few things I'll touch on. The community center opened up Monday, and if you go in there, they'll have you signing in and signing out and checking your temperature. I know Terry's got a couple of small events that are happening this week out at the convention center, and has a wedding for, I think, 300 out there next Friday. So they're starting to get some bigger events booked and working with Four Corners on that. I know the library's open, and so most of our places, the aquatic center is full, and they're working on the chemicals. And Cherie told me yesterday they're planning on opening Monday, so they'll have that going. And so most things with the city are kind of hopefully safely getting kind of open back up. And I would mention that we're expecting a little bit of a crowd again next council meeting next Thursday, and because of that big event at the convention center, we're going to meet at the auditorium. We're going to have that meeting there, and with any luck, maybe we'll have some good news on a couple of other subjects. So that's all I have this morning.
Thank you very much. And Aubrey, are you on for Henderson this morning?
Actually, Lisa, I'll be talking for Henderson.
Hi, Connie. I didn't see you on the list.
That's all right. Yeah, we opened up our offices last Monday, and the playgrounds we also opened up. We're going to keep the restrooms closed in the parks. And tomorrow we are opening up our swimming pool to 90-minute sessions. We're limiting it to 35 people to start, just so our lifeguards and staff can get accustomed to this. We are limiting the sessions per family for 3 sessions per week to start, and then we'll probably see how it goes, and if we can, we'll increase the numbers. I know our capacity, we can allow up to 75 people here, but we'll start off with the 35. So other than that, that's where we're at.
Hey, Connie, quick question. Are you limiting that to Henderson or your county residents, or going wide open?
We are going wide open. We figured if you have to sign up for 90-minute sessions, people from other places aren't going to drive that far. So we'll see how it goes. But yeah, right now we are open to all.
Okay, thank you very much. Do we have anyone on from any of the villages? Madonna, do you see anyone? Okay, we don't see anyone. If you are there and want to speak, please jump on. Otherwise, we'll move to medical sector. Jim?
Good morning. Yes.
Good morning.
Really not a whole lot new from last week. Still doing elective surgeries, outpatient procedures, PPE going well. Outpatient testing still at decent numbers, but has come down since where we were at in May. We've done since mid-March through yesterday. We've done 330 drive-through tests, and in May we did 216 of those 330, and then really the first 10 days of June we've just done 53. So it has gone down some, but knock on wood, all those continue to be negative, and as Laura's attested to as well, with no growth in York County as of late. And I think that Laura touched on the Test Nebraska and working with some of the hospitals in the district, and I know that we've got individuals in our organization working with Four Corners on the specifics, and it's happening pretty quick. And so probably doing some training next week on that and looking to get going and being seeing those Test Nebraska through, with our staff and our professionals. And I think that'll be a very good thing. Let's see, the Wellness Center opening up now in its second week continues to ramp up a little bit. Chris Payne tells me that classes are beginning again next week also. And of course, we're doing that under the restrictions that we need to. And so that appears to be building up slowly. So we have our visitation policy in effect and some changes to it as of June 2nd. And those are out on Facebook, on our Facebook site. And I did want to remind everybody, because anytime you change something within our organization, some people may tend to think that's over all of our entities, and it's not. This is just the hospital that has changed. And so just to remind individuals that, or people that the Hearthstone stays with their same restrictions at this point in time. Specifically, I'll tell you that from Jay Colburn is that he's required to have a gradual reopening plan or scenarios that they are going to submit to the state on June 22nd. And Laura, I'm not sure how that factors in, if that goes to Four Corners as well. Jay didn't elaborate on that, but I do know that is something that that he's working on. So stay tuned on the Hearthstone. Willowbrook, in some isolated cases or isolated instances, has had some courtyard visits that have occurred in a very controlled manner with distancing and chairs, and I hear tape and masks and everything, just to be able to have their residents have some outside courtyard visits. And the one other thing, Laura, certainly I'm sure you plan on getting the information out that you talked about on the baseline, I think you call it long-term care facility baseline testing. And we'd, of course, be very interested in getting that information too, whether you send it to me or to Jay or to both. Make sure that I'm sure we'll be attending all of those informational meetings. So I appreciate that update, and I'll certainly pass it on to Jay as well. And that is all I have today. Thank you.
Thank you very much, Jim. Do we have anyone else from the medical sector on our meeting today? Okay, so we will move on to the business sector, and I will kick that off today. YCDC is releasing a child care survey to our business list to identify what our child care needs are, but also how it's impacted your employees' abilities to come back to work or work at home or be in the office. So when you get that yet this week, please take some time to respond. We will be releasing those results at the Child Care Forum on June 25th, which is virtual in the evening. And we want this to be a conversation between the business community, whether you're HR, an owner, a manager, an employee, whatever your role is, and our child care providers. So if you would like to attend that, please email Chandra Berlin. Her email is chandra.berlin@yorkdukes.org. And hopefully you're able to make that. We will afterwards release the results as well. Got a couple of things on here. If you are, just a reminder, if you are receiving unemployment benefits and you are called back to work, you have to go back to work or work with your boss and your doctor if there's a health reason not to. Otherwise, you're going to lose those benefits. On that aspect, if you don't think you're going to have that position to go back to, there have been over 100 jobs since the first posted on AnyWorks and about 200 since May 15th for a 20-mile radius of the city of York. So people in York County are hiring, and YCDC is kicking off a soft opening, a national target ad this week. So for those businesses, especially YCDC members, If you have openings, please get them into our job directory. It's one of the benefits we offer you, and we're going to have more exposure over the next month for those jobs. So if you're looking, go to our directory or go to Any Works and filter down to York with a 20 or 50-mile radius. And then I just want to remind people, as our businesses and our communities, especially our service businesses, are opening and our community facilities, be patient. They're still trying to figure out their regulations, who has to take temperatures, who doesn't. So be patient, have some fun with it, and just be kind. Let's show our community spirit, our York County community spirit of being welcoming and making sure the business community knows we are very thankful that they are able to reopen. And that is all I have. So I'm going to turn it over to Madonna Mogul with the Chamber of York.
Good morning, everyone. I just have a few things to highlight. Next Thursday, June 18th, we will be kicking off the Farmers Market. York County Relay for Life will be spearheading that, and we're working with them to transition. The Farmers Market will be at the Kilgore Memorial Library, and we are utilizing the guidelines that were provided to us from the state on how to safely and effectively operate the Farmers Market. Stay tuned to our Facebook page and our website for some events that we've been able to continue to coordinate and execute with the recent lifting of restrictions. So we're very excited about that, and I will echo Lisa to just continue being kind to our businesses as they are reopening. They're certainly becoming more and more comfortable, and they're very excited to have all the support of the community.
Thank you, Madonna. Does anyone else from the business community want to say anything at this time? Okay, moving on to our education sector. I believe Mitch was on.
Yeah, good morning, everybody. Just really a couple updates like everybody else here. Just a reminder that we're hopeful that the weather cooperates with us and have a graduation ceremony on June 27th, 2 p.m. at Levitt Stadium. Jason Heights, our high school principal, is working hard getting that all organized and so on. We've asked for internal volunteers to help us gates as we have pre-registered guests and check-ins and a pre-health screening at the gate, those type of things. So again, if we have a rain date set for Sunday, June 28th, in case, and if worst case scenario is that Sunday afternoon, June 28th, we would have to move to the city auditorium if we just have bad weather all weekend. And again, we're hopeful we don't have to do that, just because we really have to limit then how many adults. We have to go down to 2 in order to meet the 50% capacity DHM. So again, working hard to do that right. It won't. There'll be some traditional things with the ceremony, but again, we're just not able to have some of the normal things like the band and the choir there. Moving on to fall and school, no decisions have been made yet. We're really hopeful that by mid-July that we'll have some type of direction from the commissioner and governor of their thoughts and so on. And so I know a lot of meetings are taking place and a lot of discussions are being had. So again, we're hopeful for that. In the meantime, last week I talked about we have created a blueprint with 5 different scenarios, and so we're continuing to work on that. Matter of fact, today at 1 o'clock we have an internal core task force that the admin team is going to present that blueprint to start getting some feedback from more than just the administrative team. So that involves some of our directors, teachers, maintenance, those type of staff members. So we're excited to show them that and start getting some feedback from them. And then, eventually here we will be reaching out to parents and students to get some feedback from them. So again, the idea behind the blueprint is that we're doing all the prep work now for some possible scenarios that we think could be realistic. That way we're not scrambling mid-July because we know it's going to be a little bit of a scramble. But again, we feel like we can prepare for a few scenarios. I will be sending out a parent letter here in the coming days to outline some scenarios, just to make sure that our parents are aware, of some of the struggles that could come our way. So for example, transportation. We already know, I sent a letter out way back in December to our families. We're going to have to reduce our number of stops in town due to basically our lack of drivers. And so we already know that. We're still going to provide transportation, but we could, depending on capacity and so on, we could have to reduce transportation to 50%, which would be a great challenge for us because obviously we still want to provide that service. So again, there's a lot of things we don't know, which is frustrating for us and for everybody. But again, I think we just have to have some patience, but yet still be prepared. Let's see here. Just checking my notes. Want to make sure I covered everything. So yeah, I think that's probably the best update I have for this morning. So if ever you have any questions or have some feedback for me, please reach out to me. I'd be glad to have the conversation. Thank you.
Thank you very much, Mitch. Do we have any other? Okay. Do we have any other district superintendents on? No. Okay. York College message that they don't have a report today. Heather from Southeast, do you have one you would like to prepare or share?
Yeah, good morning.
Good morning.
So we are getting ready to go into phase 2 of reopening a lot of our locations. As of right now, what our understanding is July 1, we will be back, at least back in our learning center. As far as people coming in and out, it will be by appointment only. So we'll continue to still provide the testing that we do for students getting ready for the semester. One thing I would like to share is there has been several colleges that are doing where they're starting earlier in the school year and then they'll be ending earlier around that Thanksgiving time. As of right now, SEC is not planning to do that. We will still continue to start at our regular scheduled date in August and work through the remainder of the semester. So unless something changes, that's where we're at right now. So we're looking forward to getting back into the learning center and being able to kind of get back to some normalcy. So.
Thank you, Heather. We appreciate the update. And the next section is our faith communities and nonprofits. I'm going to pull the data up. There's some on the chat, but we want to make sure Facebook gets it.
We do have a message from Erin Sams. She had to join another meeting. She said the update that Blue Valley is open Monday, Wednesday, Friday from 1 to 3. York County Health Coalition has dispersed 569 fabric face masks to organizations around the county for families, individuals, and children. They still have about 200 masks, and if you need one for yourself or your organization, such as your employees or clients, please contact Erin at 402-745-6604.
Thank you very much. And DHHS did not have a report. Do we have anyone from the faith community on this morning?
Hi, I'm here from the York County Ministerial Alliance.
Good morning.
Good morning. I don't know that I have anything new, but just to remind people that if there are needs, we're here and we're available. And you can look up all the information on our website, yorkcountyministerial.com. Mostly we focus on helping folks with their utilities and their rent, but if you call, we can generally help with other things. So we are always out there as a source of assistance to people And if you have any questions, if you pull up the list of churches who can okay funds, you can call any of us and we can answer questions for you.
Thank you very much. Okay, we did receive a message on Facebook that from Stephen with Henderson State Bank that June 30th is the last day to apply for the SBA PPP loan. So if your business has not applied and you need to, contact your banker. Yeah, they're all very familiar with it here in the county. But that June 30th will be here before we know it. And I believe that's it, except for questions. So does anyone have questions for any of us? For Laura, Jim, Mitch, myself, Madonna, city, county, communities?
Lisa, I had a question sent to me in chat. This is Laura.
Okay, good morning, Laura.
Yes, hello. I think it's probably something a lot of people, this is a question that we're getting quite a bit, is questions about those antibody tests that are available, that now they're becoming more available and the FDA is approving some of them, and just questions. Oh, I'm so sorry, my dogs are barking here. The situation right now with the antibody test, I'm sorry, I'm laughing. My husband's trying to round up my dogs downstairs. Forgive me. The question is really with those antibody tests is, what does it mean if you get a positive result? So, you know, for right now, the antibody tests are really a little bit more, you can satisfy your curiosity if you have some antibodies to a coronavirus, but we're not really exactly sure what they mean yet. So in terms of trying to figure out if you have coronavirus, still getting that test from your healthcare provider, that's the nasal pharyngeal swab, that's the one that's going to tell you if you're presently infected. We're just not exactly sure yet what those antibody tests mean, and there's probably a place for them in the future once we really figure out what they're telling us. We're not sure that they give you immunity or how good that immunity is, or if it's the immunity to the correct coronavirus strain, or there's a lot of questions about them yet. So. But we think that in the future, as we learn more about this, they will be more important. And we do have providers that are starting to offer them for use in the community. But again, we're just not sure what they're telling us. So I hope that answers the question.
Yes, thank you very much. Do we have anything else on Facebook or Zoom chat? Okay. Well, we will wrap up the meeting today, and Laura, next week.
Let's plan on still going next week for another briefing. I think that we've been talking with Lisa and Madonna about, you know, if our numbers continue to go down, that's a really good trend, and maybe we go every other week for a briefing. So let's plan on next week again. We have seen a couple weeks where it's gone down. It'd be nice to see one more week, and then we can discuss if we want to maybe go every other week for the briefing. So thanks.
All right, we will go ahead and wrap it up. Everybody have a wonderful Thursday and a great weekend. Thank you very much.